Hello and welcome to today's webinar with eLotus, your leading provider of acupuncture continuing education. My name is Donna Chow and I'll be hosting and moderating today's class for you. Today's webinar is the second of 12 in 2023. Dr. Chang will be speaking once a month on a popular topic that we as herbalists see most in our clinic. Today's topic is headache, migraines, and neck pain, presented by Dr. Jimmy Chang. Class time will run from 2 to 4 p.m. Pacific time, and we will have no break. Now for important details about the chat room, questions for our instructor, and your CEU quiz. For the chat room, please set your chat preference to everyone so that all attendees can see what you're typing and be part of the conversation. For questions for Dr. Chang, we ask that you type them directly to the Q&A box instead of the chat room. And finally, your quiz. It will be available the following working day, and an email will be sent to you when it's ready. Our speaker today is Dr. Jimmy Chang, a doctor of Chinese medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in differential diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique herbal combinations. You'll learn about a range of herbs for relieving different types of ailments, and you will also learn the pulse indication for these specific conditions and how to prescribe a unique herbal formula. Dr. Chang previously taught a number of courses for us, which are now available for distance learning CEUs. If you want to be able to feel a patient's pulse, identify the Western medical diagnosis, and create clinically effective herbal formulas, Dr. Chang is the person to learn from. He'll be able to help improve your pulse skills and herbal skills. For learning his pulse system, I do recommend the Gold Pass membership. With this yearly membership, you have unlimited access to his foundational pulse courses and herbs. With the Gold Pass, you can also try the herbs he mentions because our sponsor, Evergreen Herbs, will provide you with an herbal voucher equivalent to the value of your Gold Pass. If you are serious about learning herbs and becoming proficient in them, there is no better value. And I'll share more information in the chat room once I return to my computer. For now, let's go ahead and begin today's class and welcome Dr. Chang. Thank you very much, everyone. And Dr. Chang, thank you so much for your generosity, sharing your knowledge, and taking the time to teach us all today. The topic for Dr. Chang's next webinar, which is next month, is going to be on anxiety, panic attacks, and insomnia, and the date is February 15, 2023. For our attendees, if you enjoyed today's class, we'd appreciate if you could share your thoughts on social media to help promote both our speaker, Dr. Chang, and eLotus. And as a reminder, the CEU quiz will be available tomorrow, and an email will be sent to you when it's ready. Thank you again for joining us today, and we will see you at the next webinar. It'll be a weekend webinar on January 21 and 22. Amplify your acupuncture results with frequency-specific microcurrent. Part 1 will be on Saturday with Shannon Goosen, in which participants will learn the history and current applications of microcurrent to treat acute and chronic pain. And Part 2 will be with Jimmy Yen. This course introduces novel approaches to treating acute pain with FSM protocols in order to keep pain from becoming chronic. Thank you guys so much, and we will see you at our next webinar. Bye.
All right, guys, it's me again. Before we begin, I wanted to give a brief overview of Dr. Chang's herbal style because he doesn't use herbs in the traditional way that is taught in school. He only uses extract powders exclusively with evergreen herbs. Evergreen carries approximately 300 single herbs and 100 formulas, and Dr. Chang's pharmacy has about 150 single herbs and formulas on shelves covering up two walls. And if you want to get an idea of how his pharmacy looks like, I've included the link for you in his lecture notes. It's a YouTube link that you can watch later on after class or during the break time when you have time. Formula evolution. Dr. Chang has his own formulations, which he frequently uses in his practice. He typically names the formula by what it's used for. So, for example, stress. These are his newer formulations and are subject to change as he sees more patients and modifies them accordingly. Whenever he updates the formula, he'll add a 2.0 after it so that there's a version 1 and a version 2. So what is Fang Jia Fang? If you're unfamiliar with the concept of Fang Jia Fang, it's the combination of different formulas to yield a better effect. It is possible to do with raw herbs or with extract formulas. Each evergreen extract formula is decocted and extracted all together at the same time. This is very important as it's not the same as combining 4 different single herbs to make the formula. So the idea behind Fang Jia Fang is to use formula plus formula, not all single herbs together. So for example, if you're making lasagna, the taste of lasagna is not going to be the same where you cook all the ingredients together versus cooking the meat separately, having the cheese separate, and then cooking the sauce separately, and then putting everything together. The ingredients don't mesh well. It tastes way better if you cook them all together. That way they all, they're all friends, they spend time together, and they just make a better lasagna. So, but if you don't understand the concept of Fang Jia Fang very well, no worries at all. Dr. John Chen does have a video explaining Fang Jia Fang in greater detail to help you understand the concept. And the link for the YouTube is also in your lecture notes. Dr. Chang, he gives herb bottles in 100-gram or 150-gram bottles. The 150-gram is for patients who aren't local or if it's a chronic condition. And the bigger bottle also allows the patient to receive a discount. For those 100-gram bottles, he typically prescribes 3 spoons 2 to 3 times a day. All right, so how to read Dr. Chang's prescription. So looking at the slide right now, you see Win combo is Gegentang, Jingfang Baidusan, and then at 50. So what this means is that both formulas are at 50%. So if it's a 100-gram formula, you're going to put 50 grams of Gegentang and then 50 grams of Jingfang Baidusan. You put it together and then you shake it up. Be sure to ask your patient to shake the bottle before consuming it. That way all the ingredients just mix well together and the heavier herbs aren't just settling at the bottom. The second example, this one's a little bit harder, so pay attention. The blood pressure number 2, it has Tianma Go Tengyan, Bansha Baizu Tianma Tang at 30. So what do you guys think this means? You can go ahead and type in the chat room too. So we're looking at the previous one. That means it's 30 grams Tianma Go Tengyan and 30 grams Bansha Baizu Tianma Tang. But there's more formulas. There's Longdan Shegan Tang and Go Teng at 20. So this means that everything after the number 30 is 20 grams. So let me start over. So Tianma Go Tengyan is 30 grams and Bansha Baizu Tianma Tang is 30 grams. Longda Shegan Tang is 20 grams and Go Teng is 20 grams. So this equals 150 grams. So you can use either in your head. For me, I like to use the grams, but you can also think of it as percentages too. So if you want to make something that's 200 grams, then just go with percentage. That way the end result will be 200 grams. You guys got it? Of course you do. You're so smart. Okay, so do you have to mix herbs by yourself? You certainly can. Some formulas such as circulation sanjiao, astringent, and herbal ABX have already been pre-mixed as collection formulas. These are Evergreen's proprietary line. And many of the new formulas are not pre-mixed because Dr. Chang is still customizing them. So feel free to mix them on your own, or you can make your own and modify it a bit. So that way it's your own formula and you create your own. All right. So if you guys, without further ado, let's go ahead and welcome Dr. Chang. That's the end of this short intro, and I hope it was very informative for you. All right, let me go get Dr. Chang for you guys. Here he is.
Hi guys, it's me again, Jimmy Chan here. I'm very glad to be here with this topic of headaches, migraine, and the neck problem. I'd like to meet you guys, some new friends and some old friends here. Today we're going to talk about some very popular problems you will encounter in your office every day. Okay, let's get on with it. The pretty lady just told you how to use my Fang Jia Fang. Actually, it's no big deal. Just put some simple or easy to use herbs and the formulas together to form a group, a teamwork to deal with the disease. Okay, first, one day in your office, some new patient came in and doctor, help me, my head is killing me. I have seen too many doctors, they didn't know why. And I've seen this almost every day, even today. I saw a big guy with headaches and he couldn't get, he was taking Tylenol and aspirin for quite a long time. But yeah, they help, but it's not the problem. The problem is not solved. It's still there even without the Tylenol. And Tylenol is very damaging to the liver. So I look at it's some kind of condition we'll be talking about in the later on. Oh, okay. So the problem is, usually I ask my students to do the don't ask drill. So when the patient comes in and sits in front of you, you do not ask you, how can I help you today? What's seem to be the problem? We just take our system and do the palm, do the face, do the pulse diagnosis, do the ear diagnosis. Then we ask them, what do you want me to do for you? Okay, my headache's okay. Okay, I'll fix the headache according to my findings. But the problem is a little bit too difficult for some people, some beginners, something. So let's pretend that you already know the question. The patient's already presented you with his major complaint is the headaches. So, okay, you want me to fix your headaches? So that's my job to find out how and why he has this problem. Reasons and differential diagnosis, we must find out the reason for headaches and neck pain. Also, actually, neck pain and headaches are always connected with each other. Then herbal combinations. This is the procedure. Everything here is based on my 45 years of treatment experience, not from a textbook. It's a little bit different, but you'll see. Okay, let's get on the first one. Okay, the right cun is very strong, and the right chi is long and strong, something like this. Right chi. So right cun means what? Right cun means lung and upper respiratory system, and also it means the head. Okay. If there's three solid line here, the first one means superficial. If you touch gently to the skin, you just put your finger gently on the patient's skin on the right cun, and it appears to be forceful and powerful. And then you push down a little bit deeper and still jumpy, forceful. Then you push down more and still jumpy. This is the pure yang fire pulse. More than that, it means head and the colon. A lot of a colon problem comes from this pulse. The right cun is jumpy, but it's forceful and rebounds pretty strong on on three levels, cun, superficial, middle, and deep. So that's colon and head. Then you should put your attention to the colon, the large intestine. How do we do that? We'll tell you later. And mostly it's the head. So if the headaches is the major complaint of the patient, then you know this is solid yang. In other words, it's fire. So we're going to put it down somehow, huh? And the other one, the combination of this first case is the long and wiry pause here. Right shi. So what is right shi for? Right shi is for several things. First is the Taiyang pulse, long and wiry. This is my Taiyang pulse in my 6 Qi pulse system. Taiyang is very easy. Of course, you know, Taiyang pulse is Taiyang meridian is has 2, bladder and the small intestine, but they all overlapping their channels on the neck. So this one, pulse, long and wiry pulse, is Taiyang pulse, means a lot of pressure, tension on the neck. But it comes with fire, not with dead blood. So, and this is sorry. But in my in my reverse pulse system, pulse synergy number 2, this area is lung. Where's my color? Oh, here. And here is the liver. So what liver got to do with it? Liver has wing, cold wing, and combined with Taiyang, liver is Jueyin. So this is the problem of combination of Jueyin and Taiyang. So we call it wing cold headaches. There's got to be a lot of headaches there, because not only the neck is so tight, but they can tell, hey, you have a wing in your body. Okay. Okay, there's 3 blue lines, weak, strong. This is the wing. If the pulse is weak in the beginning and on the surface and harder, pushed down a little bit, still weak, and pushed right down is very tight, very forceful, with a rebound at the 3rd level to the bottom level. That's the wing, and wing means here, the cold wing invaded to the patient's problem. And this Bagua pulse also means there's an inflammation or arthritis on the lower legs. Okay, anyway, the headaches comes from aggravated wing cold, tight headaches, neck pain, aversion of wing and cold. So both nasal congestion and runny nose. The tongue may be thin and white because the condition seems to be powerful. The pulse is strong, but still, this is a potential cold condition. So I use this 葛根汤 and 金防败毒散. Okay, 葛根汤 in California, we're not allowed to use 葛根汤with 麻黄, so there's no 麻黄 in there. Well, very pity. Wish if we had 麻黄, the power of the herb will be more stronger. Too bad it doesn't. We cannot use it. But even the 葛根, let me tell you a great secret of using 葛根. What about it? 葛根 can put more blood to your head. Remember that. So we have a lot of headaches is from an empty head. Sometimes when I start taking the pulse, I said, hey, your head is empty. The patient always asks, what's wrong with my head? What do you mean? It's empty. It's because there's no blood supplied to the head, and she will definitely have some kind of headaches, certain type of headaches. But anyway, 葛根 can open up the neck and shoulder and help the body put more blood to the head. Try to remember that, huh? If you're not too sure, you can, if the patient sits in front of you or sit next to you, you can touch his neck or her neck to see if it's cold or hot. Sometimes it's very funny. The temperature on the neck is hot, which is not exposed, which is exposed to the air, not covered by the color, by the clothes. But if you touch the neck underneath the color, which area was covered by the clothes, is freezing cold. That's interesting. Clothes covered area is cold, and this area exposed to the air is hot. That means a lot of imbalance in there. So 葛根汤 can do the trick. Okay. And 金防败毒散, you people, some been following me for a while. You know, 金防败毒散 is for what? For damp heat of the surface. So I use 金防败毒散 for skin problem, eczema and psoriasis or skin allergy or something. So usually 金防败毒散 is for surface. So in this case, it's also good for surface and for the neck and shoulder. And you got to tell the patient, do not eat any kind of a cold food. Huh? Look at this, this area. It's pretty sharp. That means this girl is a little bit stubborn, OCD. And see the darkness here? Unfortunately, this spot is right on the spot of inner ear, which if you see, no matter what, maybe we're not talking about headaches here, but if you see a black spot here, that's the inner ear, which will cause vertigo and dizziness. Something, doesn't matter the term, cause dizziness with some reasons. So if you see the darkness here, that means that blood stagnation. I had a very sad experience about my patient. Actually, it's not my patient. My student asked me to the hospital to check, a little chappy lady lying on the bed and bleeding from the vaginal area. Why she was bleeding? Because the doctor, he went to the hospital, big hospital in Taipei, for the vertigo. The doctor decided that she has some dead blood, stagnation. I don't know the term they use, but anyway, they use blood thinners to treat the lady. But before the vertigo is gone, the lady started bleeding. And when I was in the hospital, the doctor was circling around the ward and pulled out the sheet and said, "Oh, bleeding," then put it back and left. Come on. But before I can manage some blood stopping charcoal medicine, she passed away. So that's sad, right? But the problem is, if there's a dark spot here, that is some dead stagnation in the ear causing headaches and dizziness. Huh? Now you learn this is worth the entire seminar. Well, for the neck and shoulder, this guy or this lady or something seems to be fine. No big deal. This line means sleep disorder. We'll be talking about sleep affective disorder in February 15 and March, about the emotional condition. You should look at here. This area. What does this place look like to you? It's so pale with the wrinkles. That means this guy has no blood supply in the ear. I'm sorry, in the head, and very stressful. Okay. So if the cold wind here like this, you should use 葛根汤 for the neck pain and something. I once treated a military guy, a dentist, army dentist. He couldn't lift his arm to perform what dentists do, because he was taking cold shower in wintertime. He was soldier, so he used to take cold shower all the time. But I don't know why that day he caught cold and he couldn't lift his arm. And the doctor gave him some muscle relaxant for a couple of weeks and it didn't work. I gave just simply 葛根汤because I can use ma huang in Taiwan at that time. And his arm is fine, neck is released in a few days, and he can go back to his dentist work. So 葛根汤 is very good for cold wind and everything. Huh? Any questions? Nope. Okay. Hello. Okay. This is the first case, cold wind. So now it's winter time. I don't know which part of the earth you are in now, but anyway, we're pretty cold in California. But in addition to the weather condition, people always drink ice water, cold water. Even when it's freezing outside, somebody's wearing a short T-shirt and shorts moving around. That's no good. When you get cold that much, you get a lot of problems. Okay, let's see the question. What do you think about cold shower trend? That depends how strong and how young you are. I don't like it. I do like it. Usually I want to do that. I start using cold, warm water and slowly turn off the heat, let the cold water flowing down. It's good. I like it.